Hi, welcome to the Jeff and Jerry Show. My name is Jeff. I'm the Borough Manager of Mount Pleasant, and my co-host,
Jerry Lucia, Mayor of Mount Pleasant.
Well, today we're going to talk about something that is obviously timing. The timing is good. It's about the COVID vaccines. And our guest today is Rick, who sits in with us. And Rick, what's your position?
I'm the producer of local programming for the Armstrong Neighborhood Channel.
And our other guest today is Ed Christofano, who owns Hayden's Pharmacy. And there's 3 locations. One's in Youngwood, Donegal, and we're sitting here in Mount Pleasant today. And Ed's been very proactive in getting people vaccinated as long as he could get the vaccines. And so we thought today we'd talk to Ed a little bit and find out some of the details about vaccines and some of the questions that people have that have asked Jerry and I about the vaccinations, and Rick's going to ask some questions. So we're going to hopefully teach you some things today and have you learn a little bit more about this whole vaccine and COVID and everything like that. So Ed, welcome again to the show. You've been on several times.
Yeah, I feel like a repeat guest, so thank you very much. I appreciate it.
You are a repeat. We had some food today from the diner, which is always excellent, by the way.
Thank you.
Main Street Diner. So Ed, the first question I have about the vaccine, tell us, there's right now the Moderna, and then there's a Pfizer. Johnson has one. I believe it's going to be approved relatively soon. So can we just talk about vaccines first and what you know about it?
Sure. Right now the government has 2 approved vaccines. The first vaccine is known as Moderna. It is a 2-dose series, and the spacing between the first dose and the second dose is approximately 28 days. That vaccine can be shipped into the pharmacies, can be kept at refrigeration temperatures. It's a very stable vaccine. The other vaccine by Pfizer is a little bit trickier, and it's a pretty elaborate process how it's shipped to the pharmacy. It's shipped to the pharmacy in containers that are below 0, so it's on dry ice. They arrive at the pharmacy, and they are kept at that temperature, and then right before use they are mixed for injection. And that dosing schedule is 21 days approximately. So you have your first dose, and then approximately 21 days later you have your second dose. And the J&J immunization that's coming is hopefully going to be approved here very soon, and that is supposed to be only a 1-dose injection for immunization. So we're waiting to see where that lands with making it to market, but that would help if it does.
Ed, now the injections that you've been using right now, now which one is that?
Well, to be honest, I've been taking whatever I can get first available from the state.
I understand that.
So I've had a mix of both come through the pharmacy. The record keeping on my end, I just have to make sure that if you receive a Moderna dose today, your second dose has to be the same. Right. It's going to be a Moderna dose. Same thing for Pfizer and Pfizer. Mm-hmm. So we are doing a lot of record keeping and keeping people on a schedule as far as when the doses become available to keep in compliance.
And you started with some first responders when you started out, and I know you took care of the Mount Pleasant firemen, Youngwood firemen, mm-hmm. and I don't know what other ones, but you were doing school districts also.
Right. Well, the protocols for the state of Pennsylvania, if you are considered a 1A, mm-hmm. the top of the list for 1A is healthcare workers. We have to protect the people that are working in healthcare.
Right.
So if they were registered at haydensPharmacy.com and they were healthcare, they were given top priority to that list. And then as part of the 1A group, the next group down in that were the first responders. So they've been taken care of. And we do have a first responder pop in every now and then that we automatically prioritize to the top of the list. Mm-hmm. And then the other individuals in that category is anybody that has a medical condition over the age of 16 or they're 65 and older. So that we're still in the 1A phase right now, and there's a lot of population that fits. So that's part of the challenge we have right now is supply and demand. Able to get the supply in so we can keep working through that roster, but we are prioritizing those individuals. A case in point, and one of the misconceptions is if somebody is perfectly healthy, 35 years old, they have no medical conditions, they're not getting the vaccine from us because they're technically a 1B or a 1C. So it's a very elaborate process for us to go through, but we're trying our best to keep the records organized.
Who set that process up? I know that you're the end user, you're the one that faces the public,
Yeah.
but really, who gave you the rules and regulations of how to do the injections?
The rules were set by the Department of Health for the Commonwealth of Pennsylvania. So they drilled down those guidelines. Now, originally, going way back to the beginning, they are different than they are today. So we've gone through some changes, but now as we operate today, we're operating off of being 16 years and older with the medical conditions considered a 1A. Other individuals that are perfectly healthy, no medical conditions, they are considered a 1B if they're an essential worker, and 1C are the other professions that are not deemed essential. So with all this information about the public, when you try to build a working list, it's important to understand that we're constantly updating it. So people are being adjusted continuously, and maybe they're getting their injection somewhere else. So I have to allot for that too. It's been a lot of tedious work, but we're trying to stay on top of it the best we can.
Ed, what would happen if someone got the first dose and went somewhere else and got another first dose?
Well,
I mean, people would think they have to have more and more, and
right. I think in all candor, I think the biggest thing to instill upon people is that we need to remain calm during this. If you receive your first dose from a provider, you should by right receive your second dose from that same provider. And here's why. The state of Pennsylvania has a record. It's called the Vaccination Immunization System. And the system records when you receive your vaccines. So as you receive your first dose from a provider, the state knows about it, and they are going to allot a second dose for you specifically with that same provider. Now, I understand with the media right now and all the communication we've read about the future shipments being delayed because of supply and demand. And people started to panic and go to other sources or other areas. I mean, we've had people travel to Allegheny County, Somerset County to get their second doses. And I try to shun away from encouraging that because it's creating more chaos. When they go somewhere else to get a dose, they're in essence, in my mind, taking somebody else's first dose. So now when I do get my second dose in for that person and they say, oh, I went somewhere else to get it, well, now we have two providers and they both have extra doses because that person jumped. Is the best way to explain.
And the record keeping, that's where people talk about, wow, this is all screwed up.
Yeah.
We don't know. Because sometimes it's not the person who's running the program's fault.
Right.
And what do? If they get when they come to you that way, you're kind of stuck between a rock and a hard place.
Right. It's made a logistical record-keeping nightmare.
Yeah.
It really has. And it doesn't allow the state to ship accordingly either. So my strongest recommendation is just be calm, get your first dose and your second dose from the same provider. So the record keeping is consistent, the orders are consistent. You will be getting a second dose. If you get it from a provider, your first dose, you will get a second dose from that same provider. It might not be on time, and that's important to emphasize, but it will come. And it will come as a priority before anybody else gets their other shipments of first doses across the Commonwealth. So as we sit here today on the 23rd, that the Commonwealth is only shipping second doses. They're not shipping any new doses to any provider. They're trying to get caught up on what's owed. Once those orders have been fulfilled, then first doses will go back out again. So it's really trying to take care of the people to get the series completed to prevent a resurgence of the virus.
Well, you don't want to have everybody have the first dose and not the second dose.
Exactly.
Because you need two for the Pfizer and the Moderna.
Correct. And if we go around and immunize everybody just once, it's a possibility with the mutation coming that you could have a surge in those numbers, and then it's all for naught.
And everybody thinks they're covered.
Correct.
How many of you, oh, good.
No, good, Jerry.
No, please.
I was just going to ask, I think I might have lost my train of thought now. I was going to, that's what it was. So you had mentioned 28 days being the ideal time frame between 1 and 2, but then also mentioned second dose may be late.
Right.
That's no cause for concern, right? That someone shouldn't be.
You're absolutely right. It is no cause for concern.
Yeah.
Everything that I've read with the data, and I know that the government has recently done a press release, they're saying, per the CDC guidelines and the manufacturer guidelines, they are saying it's still effective and still viable to wait up to 42 days after your first dose. So what I spoke of earlier, the 21-day mark and the 28-day mark, we can go up to 42 days.
Okay.
And we do not have to worry about starting all over again.
Good.
Again, it's supply and demand.
Yeah.
So for my clinics that I've already done, I've done first doses. I'm in the middle of my second doses this week. My shipments have all come in. I'm gonna be about 6-7 days late because of the shipment coming in late, but they're still gonna get done before the 42-day window.
Got it.
So it's real important, like I said, that people realize, yes, I understand it's not exactly 21 days, but that was a recommendation. They're saying you're okay up to 42 days.
Yeah, and I think that information being out there might, alleviate
yeah,
some
there
of that
was-
panic of calling around. Oh my God, it's 28 days, it's not here.
There was a lot of question on
Yeah,
that.
right.
Yeah, there was.
And it didn't help, if I can expand on this just a little bit, it did not help with the confusion from the Department of Health when they started sending out shipments. There was a mistake with a lot of other providers that they were receiving vaccine, not realizing it was allotments for second doses, and they were issuing them out as first doses.
Yeah.
So, here it is again, you have people waiting for their second dose. The dose that was allotted was mistakenly given to someone else.
Oh boy.
And it happened. It was just a lot of confusion,
Sure.
and the state is fixing that with those providers. For our people that have been vaccinated with Hayden's Pharmacy, that's not been the case because our record keeping has been spot on. So whatever we received, we knew who we had coming up in the schedule for second doses, so we knew how to plan accordingly.
Yeah, and I know there's boosters, but to have such a close span of time between two vaccines and it's run by the state.
Right.
This is uncharted territory, right? I mean, this is new for a lot of people, I would imagine.
It really is.
Yeah.
We've never seen, if you go back in history, and probably a lot of the viewers can remember going to the school in the 60s getting the polio vaccine. Even before that, it was smallpox.
Right.
We've never seen something as this, that you have two doses.
Yeah.
It was always just one dose. So it is a logistical nightmare to get through. But we're all trying our best to keep organized, and like I said, we just need to maintain the course of people getting the second doses from the first provider.
I'm sure your life has drastically changed.
It has dramatically changed, yes.
And,
it has.
and I don't know if you guys were going to mention it. I mean, there was an article in the paper, which was really neat, about the situation, where you had some extra doses and, basically got in your four-wheel drive and ventured into the mountains and helped a family out.
It's the vaccine is way too important to waste, and that's one thing I could say with a lot of pride is we've not lost one dose.
Wow.
The night you're speaking of, it was a snowstorm. We had a clinic scheduled that day, and I had some cancellations due to weather. And I knew of this family, Amanda Blevins and her parents, up in Acme. And I said, I'm going to be making the trip up to get them taken care of. Little did I know that the mother and father were going to do the press release that they did. It was a good feeling to read that, but it was unexpected.
That was well deserved, though.
Well, it's just doing the best I can. I don't want to see any doses go to waste, and because of her condition, not being able to get out, it was a cry from parents for help. And I hope that with something coming with the county here in the next few weeks, we're going to develop a better methodology to handle those situations, so they can call into a call center and report that they need someone to come to their home because of conditions of not being able to get somewhere with transportation.
And I have a question. People were asking me, and I wasn't sure. I wasn't going to give a wrong answer to someone. But do they pay for, you, the person getting the shot, is there a charge to that person?
No, there's not a charge to
No.
the individual, no. There's not a
No,
copay.
if they have insurance, can you bill the insurance company?
The insurance company is notified you received the shot, and
Okay.
there is a transaction that happens for all the paperwork involved.
Yeah.
But there is no copay out of pocket to the person
Okay.
in line. If there's no insurance for that individual,
It's taken care of.
it's not a time to really look at the dollars and cents of it. It's more so about just trying to get everybody vaccinated so we can really knock the number down of occurrences.
You mentioned to get everybody vaccinated. So let's say I'm 45, I feel good. I don't go to the doctor though, but I feel good. I don't want the vaccine. What's your thoughts on that?
Well, everybody has their own opinion about vaccines. It's something we've kicked around for many years. My personal feeling is the more we can vaccinate and prevent a disease state, and let me go back, I'll use the example polio. Polio was across the country until they started vaccinating.
Right.
Smallpox, yellow fever. I think it serves a purpose. I think if everyone is vaccinated, we can eradicate what we're seeing right now with this, the pandemic we have. So my feeling is I think everybody should be vaccinated, but everybody has their own viewpoints on it.
But there's another side to a vaccine. And you know how healthcare and studies, we haven't really studied this very long. It's only been over a year, right?
Correct.
No, maybe not even over, about a year. So the data, that's why things change so much, because the data changes.
Correct.
Do you have any concern 3 years, 4 years from now, there's going to be effects of someone who got the vaccine?
There is a part of me that asks that question. I think a better question or a bigger question to ask, we're worried about the side effects 3, 4, 5 years down the road, but that person might not be alive tomorrow. So what's the greater question you want to look at? I think with anything in the healthcare industry, there is going to be a risk with it. I think the risk so far, what we've seen from the data, is very low. I'll give you another case in point. I had somebody ask me at one of our clinics about fertility with the vaccine. And there is no study right now on the fertility. If they want to have children, what is that going to do? Well, the vaccine's not been around long enough to really do any extensive studies because the normal pregnancy is 9 months. It's not been really out in general population more than 9 months. So you're going to have those questions. But I think it all goes back to the bigger question is, do you want to be with us among the living in 3 to 4 years, or do you want to just deal with the possible side effects that you could have from it 3 to 4 years? I think that's the way we need to look at it.
Those questions probably came up the same when you had the polio vaccine first come out.
Oh, correct. Absolutely.
And then the flu vaccines come out. People were probably hesitant to get the flu shots.
Yes.
Even today, you can talk amongst a group of people, and I won't get a flu shot.
Right.
I won't get a flu shot. And they'll just tell you right out, I would never get a flu shot.
And like I said, they're entitled to their opinion, but
Oh, sure.
I think just the devastating numbers we've seen across the country with the pandemic has really just, it's been an outpouring of we want to get people vaccinated and get this number in line. And I will say the early numbers of people that have been vaccinated so far within the last, I wouldn't say we've been 4 weeks now, maybe 5 weeks in just with our people, but just looking at the data full range, you're seeing a decline in Allegheny County, you're seeing a decline in Westmoreland County. So it's happening. It's just not happening as expeditiously as we wanted to with
Yeah.
the State Department with supply. But you are seeing across the country it's working, it's just not the number we would hope for.
Well, it was a happy day for me that when you called and says we'd like to give the firemen the shot. And I felt really privileged at that, and it worked out real well. I had more participation than I thought we were going to have at first.
And the State Department gave us some real clear rules to work with on that. They said, if you're getting the vaccine, reach out to your first responders, your healthcare providers, and make sure that they're taken care of, because they're on the front lines. So that was a good thing with the state. The state's done a very good job. The problem is now it's supply and demand.
Yep.
If you've only given so much, how do you say, as a Commonwealth, where does it go? I'll give you a case in point. 2 weeks ago, the numbers came in from the state. The state requested 706,000 doses. They only received from the federal supply 305,000, so it's less than 50%. How do you tell, with that number, how do you dictate where it goes in the Commonwealth? And they made some good choices with it. I'll give them credit. They picked the hot spots where we see a lot of increased numbers happening. I wish that it would have been more even, but also I'm being selfish for Westmoreland County, because Westmoreland County has come up short in receiving vaccine.
Question. With your opinion being that you think most, if not everybody, should be vaccinated, with a mortality rate so low, why would you recommend somebody be vaccinated as opposed to using their natural immunity?
We don't really understand fully how this is affecting people. I'll give you a case in point. Average 48-year-old contracted COVID, was hospitalized, and was pronounced dead within a matter of 7 days. And then you have another individual that's in their 60s, and they were diagnosed with COVID, and they fought it, and they made it through. We don't know that data yet. What is the link that this person who seems to be healthy is not making the survival rate, but someone older or younger is? It'd be nice to know that, and we're just not there yet with that information.
Right. No, go, Jeff.
Has anybody looked at the virus? The common flu that we all get shots for. Well, most of us get shots for. Is there a connection between that virus and the COVID virus, or are they two separate apples and oranges?
They're two separate apples and oranges.
Because some people also think that everybody's being labeled a COVID carrier because they're seeing the flu virus non-existent. Everybody's considering, what's the whole story there?
It's hard to determine with this. If we just talk about symptoms, it's very hard to say if you are having symptoms of the flu, or are you in this bucket and you're having symptoms of COVID? Because they're very similar, right? So when you are admitted to the hospital, if you go through the emergency room and you're being checked out by a healthcare provider, the first question they're going to say is, did you have your flu vaccine this year? If you did, they're going to treat you as a COVID patient, because they are taking great confidence in that the flu vaccine covered you from the flu, so they're treating you as a COVID patient. If you did not, they're not sure which one they're treating, but the symptoms are a lot the same. So we're watching for the same progression of symptoms. If you're COVID, we see more of the respiratory issues that start to develop, and then it becomes a little bit more invasive, so we can then shift our gears to COVID. But it makes it very hard on initial diagnosis. In addition to doing all these vaccines that we've done as a pharmacy, one of the things that's forthcoming here in the next 2 weeks is I actually got approved to do the testing. So I'll be able to do testing for COVID. Did you have COVID? Do you currently have COVID? And I would be able to give you a yes or a no to which question, so going forward, so that you can be treated better. So it's going to become more prevalent. You're going to see these testing facilities come to the communities, and we'll have these at our locations to be able to do that soon.
Well, when we get to the end of the show, I want to talk about that.
Okay.
Because I'm sure everybody's going to have that question.
We do have about 5 minutes left. Just
That's it.
Already, yeah. With the data not being sure, because it sounded like we're not sure if it's flu or COVID in many cases. Do you think that's possible that has given us bad data?
My opinion is it's hard to say.
Yeah.
It's been a number I look at, and it's really hard to determine.
Yeah.
Did you have a 95-year-old pass away due to natural causes, or did they have COVID? And it's a very hard number to pinpoint down, to be honest.
But I think people are using that to form their opinion. The data's not good. They're saying everybody's COVID because they're getting paid. Hospitals are getting paid per COVID patients. And I think everybody,
Is that true?
I don't know.
To be honest, that's out of my.
I heard it wasn't. I mean, I heard.
Yeah, I've heard that, but I don't
And
know.
I've talked to Excella, and they said no, that's not true. So I don't know, but
Yeah.
you hear so much, and then all of a sudden, a good idea about getting the shot becomes skewed or muddied because everybody's throwing these other accusations and conspiracies,
Right.
out there. And we supposedly hit the 500,000 death mark yesterday.
And the regular flu did not
No.
have nowhere
We haven't
even
heard.
dream of those numbers.
You haven't heard very much about the flu virus deaths this whole season very much at all. It's been COVID from the beginning till now. So
And how many people did you see?
That's our best understanding. It's been COVID,
Correct.
which we don't.
and
know for sure.
it goes back to being hard to dissect. Is it flu from the
Right.
symptoms, or because the symptoms are so close to COVID, is it
Right,
COVID?
right.
And we just don't know.
Yeah.
Well, I know we're running out of time. You brought up about doing the test. Let's go through that process real quick. Do you know what that process is going to be?
I do. I've already gone through the training. We have our CLIA certificate, which is a laboratory testing certificate to start doing this. It's going to be a nasal swab. It's going to be a nasal swab that'll give you results if you've had the virus or you are currently active with the virus. It's going to tell you either way, because if you had the virus, now you're a carrier, so you have that component, and you'll indicate that. And if you're currently active, that allows us to dissect, is it flu-like symptoms or is it COVID symptoms because you tested positive for COVID? So we'll be able to do that testing here shortly.
And you're going to do registration like you did it online?
Yeah, we have to do, it's a little bit more invasive. It's going to be an actual appointment to come in and do the testing, yeah.
Is the swab on the outside of the nose, or is it clear? I mean, I hear horror stories
It
about
depends.
how deep that swabs are going to be.
It depends on the technique and how you're doing it. So if
Well, I can
I
tell
give
you-
shots like the way I'm going to do that testing, okay, and it should not be
Okay.
that
So
invasive.
come see Ed to get your swab, right?
Yeah, we have 50,000 people are going to sign up. No, that's great. I mean, and I know you're very proactive.
Yeah.
Proactive. That's why I said that in the beginning of the show. We're fortunate to have you in our community. And I'm sure the other communities feel the same way because you jumped on this pretty quick.
It's how I was raised. It's how we operate in our communities because I am ingrained and invested in Mount Pleasant. I'm ingrained in the communities. We have our businesses. It's what business will you have in a community if there is no community anymore? So we jumped right in to help where we could. And
Can I get the vaccine if I get the vaccine? Can I get the virus again?
anything's possible. The chances are very minimal. If you receive both doses and you complete the series, the chances of you getting COVID are very, very minimal. It's less than a percentage point.
How about the other strains that are coming out?
From all the data that I've read to date, and again, this data changes every day.
Oh, I know.
This virus is disrupted with this vaccine, and the mutated form or the other forms of it are also disrupted by this virus or this vaccine. So it will help protect you against the other forms that are out there.
We're out of time. Is there anything else that we missed that you want to cover?
I appreciate the opportunity to talk about this. I enjoy our cup of coffee as we kind of go through all the data. It's so important just to make sure people stay calm. If I can drive one point home, we got to stay calm and work through this as a community together. It's not a time for panic. It's not a time for seeking out vaccine from other sources. It just makes more chaos. And I'm hoping as we progress as a county, there are some good things coming that I'm a part of with the task force. So we're going to try to systematically get the county taken care of, and hopefully we see an end to this pandemic very, very soon.
Well, as I said at the beginning of the show, I hope you can learn something from today's show. I think, Ed, you enlightened us a lot. I hope you follow Ed's advice on some of the things we talked about, but ultimately it is your choice. So for Rick, Jerry, Ed, and myself, thanks for watching and listening to the Jeff and Jerry Show, and we'll see you next time.